Hi everyone, I'm Danielle and welcome back to our second episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. On today's episode, Emaan and I will be interviewing Dr. Danah Albreiki.
So just to give a brief introduction, Dr. Albreki was born and raised in Saudi Arabia, completed her medical school in King Faisal University in Dammam, Eastern Province of Saudi Arabia, and then moved to Ottawa, Canada to pursue her ophthalmology residency training. She also received her neuro-ophthalmology and adult strabismus training in Ottawa and continued on academic staff as an assistant professor since 2013.
Dr. Albreiki has a very big passion for teaching and was privileged to be the winner and recipient of the Dr. William Clark Award, which is a medical teaching award for 2 years in a row, both in 2015 and in 2016. She is an expert content for the ophthalmology undergraduate program for the Anglophone stream and founder of Mentor to Inspire, which is a mentorship program for the ophthalmology residents. She's also an examiner for the National and International Royal College of Physicians and Surgeons of Canada and the founder and organizer of the first and annual Canadian Neuro-Ophthalmology Review course.
So without further ado, we'd like to introduce Dr. Albreki. Dr. Albreki, you want to tell us a little bit about yourself and your life in Ottawa?
Thank you, Emaan and Danielle, for inviting me today as your first guest on your Seeing Clearly podcast, which I love the name of, by the way. It's an honor and a privilege to be here. So a little personal blurb about me is that I'm married to a wonderful man named Hussein. He did his residency in ENT in London, Ontario, and he did his fellowship in head and neck oncology surgery in Toronto. Just to let you know that giving you this information because we lived 7 years apart. And then we had 3 beautiful boys in our journey. So Ali is 12 years old, and he was born during the residency. Yusuf is 8 years old, and he was born 6 weeks after I became on staff. And Adam is now 4 years old. He's our third boy, and he was born 5 years into my staff. They keep me going and inspire me daily.
Thank you so much for sharing that. And I guess it shows us and like everyone listening how important it is to have that balance of like a personal life and a medical career. Now just switching gears a little bit, quick question for you. What drew you to the specialty of ophthalmology and more specifically neuro-ophthalmology?
So let me take you a step back so I can tell you how I ended up doing what I'm doing right now. When I graduated from high school, I went to medical school at the age of 17. This is how it works in Saudi Arabia. There's no free medical school. And in my first year of medical school, I wasn't sure if I wanted to pursue medicine. In fact, I was planning on getting an acceptance at MIT for cognitive sciences department. Obviously, this did not work. So I continued in medicine, and in retrospect, I loved medicine. Then came the question of what to do next. And in reality, I was torn in between psychiatry and ophthalmology, which you think are very different specialties. I had the opportunity to work in psychiatry for a few months and ophthalmology for a few months after my medical school. And I found myself drawn to ophthalmology because it was faster paced, because it was fascinating with its technology. I was intrigued by the ocular pathology and surgery, and so I pursued that path. So why am I telling you all of this? Because when I became a resident, I stumbled upon this subspecialty called neuro-ophthalmology, which I've never heard of before. And I realized that the things that I liked have in common, the cognitive sciences, the psychiatry, and neuro-ophthalmology is the neuroscience part. And when I saw neuroscience combined with the eye, I was blown away. And that is exactly the field that I wanted to do. So that's what I'm doing right now. Neuro-ophthalmology is a fascinating field. It is the most fascinating field I have come across in medicine. I always have a feeling that I want to share the stories that I encounter with somebody That someone often ends up being my husband, who calls my subspecialty house, like the show. If I don't have a resident or a fellow on an odd day and I see something fascinating, I go in the hallway, look in other clinics for residents, kidnap them, and bring them over to show them something fascinating for them not to miss a learning opportunity. And my patients are always very gracious to share their pathology for learning purposes.
Thank you for sharing that. It's so wonderful to hear how passionate and excited you are and how you're able to put all your interests into like one specific field. That's incredible. Just a quick follow-up question. Would you mind just explaining to your listeners like what a day-to-day is like within the field of neuro-ophthalmology?
Sure, Daniela. So neuro-ophthalmology is pretty much investigative work. So it's kind of like being a detective, CSI, House, Sherlock, if you Holmes, if you will. We can detect systemic disease by listening to the patient's story, looking into their eyes. We can detect neurological disease, vasculitis, cancer, aneurysms, strokes, and so forth. And recognition of certain things early can be sight or life-saving. I'll give you an example. So, for example, Mr. Smith walks into your clinic, and he's 70 years old, and he says, "You know, doctor, I lost my vision yesterday in my right eye, and I have been having a headache for the past few days." And when you look in this patient's eye after taking a full history, you see that the patient has an optic nerve head swelling. So you would conclude by the history and exam that this is an ischemic optic neuropathy. The first thing you would want to rule out is something called giant cell arteritis, which is a serious condition that can cause blindness and stroke. Early recognition can reduce the risk of the other eye from being involved and also reduce the risk of stroke. And so immediate diagnosis and treatment is crucial in these kinds of cases. Another case would be, for example, Mr. Jones. He's 50 years old, and he was also sent to you for a headache. And that's the only thing on history, the headache. And when you do a full neuro-ophthalmic exam, you detect a Horner syndrome, for example. This seemingly insignificant, sign of meiosis and ptosis can reflect serious disease. And the first thing you want to think about in this case, where you have a painful Horner, for example, is a carotid dissection, which can also cause stroke and death. So you want to detect this early on so you can save the patient's life. I can go on and on, but I know we don't have all day. So.
Well, thank you for sharing that, Dr. Albreiki. It's really, really cool and interesting to see how, you have to kind of put together the history, the physical exam, and get a glimpse into your day-to-day life and types of patients that you get to see. If we could switch gears a little bit, I know that you're passionate about medical education and really involved in medical education at University of Ottawa. Do you mind talking a little bit about what exactly you enjoy about teaching medical education?
So on the larger scale, Emaan, teaching has a ripple effect. And I find it gratifying to see the residents that I have taught teach others what they have learned and continue to use the teaching pearls wherever they go, even if their residency is over. We've also opened a fellowship this year, and we're very happy with our current fellow who is going to go back to Saudi Arabia and continue to spread her ripple effect as well. Also, teaching creates better care for the patients overall. When residents know how to deal with neuro-ophthalmic cases, which can be challenging at times, I feel confident that they will work up and manage the patients appropriately and in a timely fashion, particularly when neuro-ophthalmologists are not always around. Mm-hmm. On a smaller scale, between you and me, I love teaching because it highlights my weaknesses and my deficiencies to myself. And this allows me to improve on what I know that I don't know very well. And finally, I have learned to put myself in uncomfortable situations where I pick a topic that I know that I need to learn a little bit more, and just pick a date and say, I'm going to teach this topic or I'm going to present it at a conference. So this will allow me to hone down in depth this topic and learn it really, really well.
Yeah, thank you so much. I think that, well, it's very valuable to us as learners to have such incredible role models and teachers, but it also goes to show just like how the field of medicine is constantly evolving and everyone's teaching someone else and it becomes this nice train. Just a question for more like us, but like what makes personally like a good learner or someone that you've maybe worked with?
A good learner. So over the years, I've learned myself that we learn knowledge, but we don't really learn or we are not taught how to learn. And I think there's a reason for this, as people have different ways and tools for learning. For me, I think understanding what works best for me is a step forward in my learning process, and also to keep evolving and learning tools. It used to be learning from textbooks, but now there's so many different ways of learning and resources to learn from. And the art is really how to collate these to the best learning tool for myself or for yourself.
Thank you so much for the advice. I'm sure all of our listeners will definitely take that advice and hopefully apply it when they spend some time in ophthalmology or any other specialty. Honestly, do you have any advice for students that are interested in ophthalmology? In their pre-clerkship stage or even going into clerkship?
So I'm on the CARMS committee. I sit in my office that time of year when I start reviewing CV after CV of medical students applying to ophthalmology. And I think to myself, are these even human? These students are so accomplished from an academic, research, volunteer, and personal interest that I am humbled with every CV every year. Having said that, those medical students are human, just like you and me. They do not have extra human strength or powers. They just have grit and determination. And if you have those qualities, which you both do, you too can get into ophthalmology. I would say communicating with recent medical student graduates who have matched into the field of their choice and asking them about the process and what they have had to do, connecting yourself to the ophthalmology community, whether it be it through residents or staff or other medical students who know someone. A good person to start if you don't know anyone would be the clinical coordinator of the department. And continue to be your kind self, because ultimately we just want a kind person who works hard and works well with the team.
Well, thank you for sharing that. I think that's very helpful advice to all our listeners, but also to myself and Emaan, because sometimes we're so caught up in the medical field and we forget about just like being human and being a person, because like we all are. And then now switching a little bit more towards something that we're all related to, would you mind just talking about your involvement with iCurriculum?
So I remember the day that Emaan came to me with this idea. We had spent the whole day together in the OR, and at the end of the day, after we finished doing our adjustable suture on one of our strabismus patients in room 2, you mentioned this idea. Yep. So I'm actually quite impressed with how you have transformed an idea to a tangible product, collating a lot of the ophthalmology resources on the internet into one spot and providing it to all medical students around the world. This is such insurmountable force. The credit goes to you and your team, Danielle, the ambassadors, and one of our residents there, so Jim is also involved. And I'm just here for some guidance and reinforcing your back.
Well, we definitely appreciate all of the guidance that you give to us and all of the advice that you've given to us, and to build what we have now. We definitely wouldn't have been able to do it without you. So thank you for all of your help, and again, thank you to everyone else that you mentioned. That's helped us with that. To finish off, Dr. Albreiki, we have a would you rather question for you. So we're kind of doing this at the end of all of our podcasts, but for you, would you rather have a third ear or a third eye?
With no question, a third eye, of course. And that would be for many reasons. But I don't think we want to get into the list of that.
Honestly, I think I would take a third eye too. How about you, Emaan?
Yeah, no, I'd definitely take a third eye as well.
Yeah.
Seems like the obvious choice on this podcast.
But I'll tell you a secret. Moms actually have a third eye. So I'll take a fourth eye.
Exactly. Yeah, maybe mine would be on the back of my head. I'm not so sure. But thank you so much, Dr. Albreiki, for joining us today. I'm sure your advice, and I actually know your advice and your recommendations will be appreciated by all our listeners. And thank you to all our listeners for listening and coming back to our podcast, Seeing Clearly.
I can't wait to share our next guest with you, and hope you tune in to listen to more advice and to more experts in the field.
Thank you, Emaan and Danielle. It was a privilege and a pleasure to be here.
Thank you. Bye, everyone.
Bye, everyone.